Welcome to The Explainer. Today, we're going to pull back the curtain on autism spectrum disorder. We're moving past the label and digging into the specific clinical framework that doctors actually use to make a diagnosis. Let's demystify this.
You know, we hear the word autism a lot, right? But how does a clinician actually go from observing someone to giving an official diagnosis? Well, it's not a guess, and it's not a hunch. It's a very structured process with a really specific checklist. So let's walk through that checklist together.
Okay, so the entire diagnosis really boils down to two core areas. You could think of them as the two mini ingredients you absolutely have to have. The first is a consistent pattern of challenges in social communication. And the second, that's having restricted or repetitive behaviors. We're going to tackle that social piece first.
All right, this first piece of the puzzle is officially called Criterion A. It's all about the social world, how a person communicates, how they connect with other people, and this part is absolutely mandatory for a diagnosis.
And right away, here is a super critical detail. This is not a mix-and-match list. It's not a buffet. To meet Criterion A, a person has to show persistent difficulties in all three of the specific areas we're about to cover. Not one, not two, but all three.
So what are these three required areas? Well, they cover the whole spectrum of social life. First, there's what they call social-emotional reciprocity. That's basically the natural give and take of a conversation. Second, it's about the unspoken stuff, nonverbal communication, eye contact, body language. And third, it's about the challenges in actually developing and keeping relationships. Let's see what that looks like in the real world.
This quote from the actual diagnostic manual really nails it. It talks about a failure of normal back-and-forth conversation. See, this isn't just about being shy. It's a fundamental difficulty with the actual rhythm and flow of a social interaction.
And for that third point on relationships, the manual gives examples like having a hard time with imaginative play as a kid, or even what it calls an absence of interest in peers. You can see how that would make building those social bonds incredibly challenging.
Okay, so that was the social communication piece. The second mandatory pillar for a diagnosis is Criterion B. This one focuses entirely on behavior, specifically those restricted and repetitive patterns of behavior, interests, or activities we mentioned.
Now notice the huge difference here. For the social part, you needed all three. But for the behavior part, a person only needs to show at least two of the four types we're about to see. And this is where a lot of the variability in autism comes from.
And these four types cover a lot of ground. You've got repetitive movements or speech, like hand flapping or echoing phrases. You have an intense need for routine and for things to stay the same. Then there are those highly specific, deep interests, like knowing every single detail about train schedules. And finally, a different way of experiencing sensory input.
That idea of insistence on sameness is so powerful. We're not just talking about someone who likes to be organized. The manual describes it as extreme distress at small changes. For someone with this trait, the world needs to feel predictable. And having that routine broken can feel incredibly upsetting.
And this really brings that sensory part to life. It can show up as being hyper-reactive, where a normal sound is painfully loud or a clothing tag feels like sandpaper. Or it can be hypo-reactive, like having a really high tolerance for pain. It's like the volume knob for experiencing the world is just set to a completely different level.
But hold on, we're not done. Just checking off the boxes for criteria A and B isn't enough to make a diagnosis. A clinician has to consider three other critical factors. Think of these as the final quality control checks.
So the next check is Criterion C. The traits have to have been present since early childhood. But here's a really fascinating part. They might not have been obvious back then. They can be masked by strategies someone learns to fit in. The traits might only become really clear later when the social demands of school or a job become too much for those coping mechanisms.
Next up is Criterion D. This one answers a really important question. So what? Do these traits actually cause problems? For a diagnosis, they have to cause clinically significant impairment. This means they aren't just quirks, they create real, tangible challenges that impact a person's life at school, at work, or in their relationships.
And the final check, Criterion E, is all about ruling things out. Could these challenges be better explained by something else, like an intellectual disability?
Now, it's really important to note that someone can have both. But if they do, the autism diagnosis is only added if the social communication challenges are significantly greater than you'd expect for their general developmental level.
Okay, so after walking through the social challenges, the repetitive behaviors, and all those final checks, what does the complete diagnostic picture look like when you put it all together?
Here it is. This is the whole diagnostic funnel in one place. You start at the top. You have to meet all 3 of the social deficits from criterion A. Then you need at least 2 of the behavioral patterns from B. And finally, you have to pass through those last 3 checks. The traits started early, they cause significant impairments, and they're not better explained by something else. It's a tough, rigorous process for a good reason, to make sure the diagnosis is accurate and that it leads to the right kind of support.
So, why does understanding this clinical what really matter? Because I think it completely changes the how we can approach empathy and support. When we can see the specific, detailed criteria, we can finally move beyond lazy stereotypes. It gives us a much clearer lens to appreciate just how diverse the experiences of autistic people are, and it shows why a professional, thoughtful diagnosis is so incredibly vital. It's the true foundation for real understanding and meaningful support.